Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts, and this one comes in from Reddit, and the question is, ingrown hair regimens. Hello, I have the worst ingrown hairs. I won't be posting pictures since it's very self-explanatory. I get them everywhere I try to shave, legs, arms, literally anywhere. I need some recommendations for helping to get rid of them. As I mentioned before, I do shave, I use a shave oil to shave, and I do have a multi-blade laser from Dollar Shave Club. I do try to exfoliate when I remember to, but regardless, I still get so many ingrown hairs. Does anyone have any tips? Well, that's a really, really good question. Like I always say, your best bet is getting to see a local board-certified dermatologist who can take a look at the situation and make some precise recommendations for you. If you're in the New York City area, you can come see the doc. I'll be happy to help you out. But if you're not, I'm sure you can find someone wonderful wherever it is that you may reside. Now, to your question. So this is actually a very common problem. When you shave your hair, it's like somewhat of a traumatic process, and some folks can actually break out with what's called folliculitis, which is like an acne-like breakout where you shave your hair. It's actually from the mechanical shaving of the hair. It irritates the hair follicle, and then you can end up with some inflammation, which leads to like something that looks like a zit or an ingrown hair. There are a couple of ways to mitigate that. And again, you'll need the help of a dermatologist to do some of this stuff, but generally what you want to do is you want to warm up the skin before you shave it, then you shave, and then you want to cool down the skin immediately after you shave it. So for instance, like folks that get this on their neck, I frequently tell them to use hot water before you shave, use a good shaving cream, a nice blade like the one you're using, shave, and then as soon as you're done shaving, use cold water right on top of that. Now sometimes what I do in addition to that is I prescribe my patients a prescription cortisone lotion, which I have them use immediately after shaving, and then they reapply that 12 hours later. So 2 applications. And what that does is it calms down some of the inflammation that's caused by shaving and helps like mitigate the formation of folliculitis or acne or ingrown hairs. I don't love the word ingrown hairs, but we'll use it for the purposes of this post. The ultimate gold standard solution for this is actually laser hair removal. So a lot of folks have this recurrent issue despite, using the recommendations I just described. And for those folks, I frequently say, listen, if you laser the hair away, that's the chicken that's laying this ultimate egg of the folliculitis that you're getting. So when you remove the chicken, there are no more eggs. If that's an option for you, that's something I would consider, because it sounds like your ingrown hairs or folliculitis or acne, whatever you want to call it, is severe, and it's obviously bothering you enough to kind of post about it to get some recommendations. So that'd be something you want to consider. Also something that your local board-certified dermatologist can review with you. I hope that answers your question. Let's get it.